Health and safety concerns related to 5G technology. Introduction to 5G technology and its rollout. 5G, or the fifth generation of mobile communication technology, is designed to provide faster data transfer speeds, reduced latency, and improved connectivity compared to previous generations, such as fourth generation. It enables advancements in technologies like autonomous vehicles, the Internet of Things, IoT, telemedicine, and smart cities, with promises of near-instantaneous communication, high-bandwidth applications, and greater network capacity. However, as 5G networks are rolled out across the world, there are increasing health and safety concerns among the public, regulatory bodies, and health professionals. These concerns primarily focus on the electromagnetic fields, EMF, emitted by 5G systems, the increased infrastructure required to support 5G networks, and the long-term effects of exposure to these new technologies. 1. Electromagnetic radiation, EMF, exposure and its risks. Nature of 5G radiation. 5G uses higher frequency electromagnetic waves, particularly millimeter waves, which fall within the electromagnetic spectrum between 24 GHz and 100 GHz. These higher frequencies are different from the lower frequencies used by earlier generations, like 4G and 3G. Millimeter waves are absorbed by the skin and surface tissues rather than penetrating deeply into the body, but they raise concerns about their impact on human health, especially with the widespread proliferation of 5G base stations. Potential health risks. Thermal effects. High-frequency radiation can potentially heat tissues, much like microwaves, though the power levels used in 5G networks are generally low. Concerns remain about the potential for cumulative or chronic exposure, leading to thermal effects on the skin or deeper tissues. Non-thermal biological effects. Some studies suggest that non-thermal biological effects could occur even without the heating of tissues, such as changes to cellular activity, disruption of the blood-brain barrier, or DNA damage. These concerns have been raised in the context of both 5G and earlier wireless technologies. But with 5G's denser network of small cell towers, some fear the effects may be more pronounced. Cancer risk. Several studies have explored a potential link between prolonged EMF exposure and increased risks of cancer, particularly brain cancer. While agencies like the International Agency for Research on Cancer, IIRC, have classified radiofrequency electromagnetic fields, RF EMF, as possibly carcinogenic to humans, Group 2B, the scientific community has not reached a consensus. With 5G introducing higher frequency radiation, some scientists call for more in-depth research into its potential cancer-causing effects. Electromagnetic hypersensitivity, EHS. Some individuals report symptoms like headaches, fatigue, dizziness, skin irritation, and difficulty concentrating when exposed to electromagnetic fields. Although there is limited scientific evidence linking these symptoms directly to EMF exposure, electromagnetic hypersensitivity, EHS, remains a widely debated issue, with many claiming that 5G may exacerbate these symptoms due to increased RF exposure. 2. Long-term health impacts of 5G. While immediate health effects of 5G exposure remain largely inconclusive, there are concerns about long-term exposure to millimeter waves. The long-term effects on human biology have not been fully explored, as 5G is a relatively new technology. Chronic effects, cellular stress, and oxidative damage. Some studies on lower frequency radiation have shown that prolonged exposure to RF radiation can cause cellular stress, oxidative damage, and changes in cell membranes. With 5G's high-frequency waves, there are fears these effects could be amplified. Impact on DNA. There is some evidence suggesting that prolonged exposure to RF radiation could lead to DNA damage, which may increase the risk of genetic mutations or cellular changes over time. However, such research is still in its early stages, and its relevance to 5G frequencies is yet to be fully understood. Sleep disturbances and circadian rhythm. Some research indicates that RF radiation might interfere with melatonin production, the hormone responsible for regulating sleep. Since sleep disruption has a significant impact on long-term health, concerns about whether 5G could contribute to sleep disorders are part of the broader discussion. Developmental concerns. Children are considered to be more vulnerable to radiation exposure than adults. Since children's bodies are still developing and their tissues are more absorbent, some health experts suggest that prolonged exposure to 5G radiation could have developmental impacts, especially on the brain. Vulnerable populations. Pregnant women. Concerns about the impact of RF radiation on fetal development have been raised, particularly regarding neurological development. Although there is no definitive evidence linking RF radiation exposure to birth defects, the potential risks for pregnant women and their unborn children warrant further investigation. Elderly and immunocompromised individuals. The elderly and those with weakened immune systems may also be more susceptible to environmental stressors, including electromagnetic radiation. Prolonged exposure could potentially exacerbate pre-existing health conditions or accelerate aging processes. 3. Environmental and ecological concerns. The potential environmental effects of 5G technology are an emerging area of concern. Given the rapid deployment of 5G infrastructure, including thousands of small cell antennas placed on streetlights, utility poles, and buildings, the impact on ecosystems and wildlife has come into focus. Wildlife and ecosystem disruption. Impact on insects. There are concerns that electromagnetic fields, especially from 5G's millimeter waves, could affect insects, such as bees and butterflies, which are vital to pollination and the health of ecosystems. Some studies suggest that RF radiation could disrupt the navigation systems of insects, affecting their ability to migrate or reproduce. Birds and migratory species. Birds, especially migratory species that rely on natural electromagnetic cues to navigate, could be adversely affected by the widespread installation of 5G base stations. There is evidence suggesting that artificial electromagnetic radiation could interfere with birds' ability to orient themselves during migration. Fourth, infrastructure and safety. Concerns? The physical infrastructure required to support 5G networks introduces a range of safety risks, particularly for workers involved in installation and maintenance. Increased number of small cells. Unlike previous generations, which relied on fewer, larger cell towers, 5G requires a much higher density of smaller base stations, or small cells, that are spaced much closer together, often only a few hundred meters apart in urban areas. This means there will be more antennas installed in public spaces, on buildings, lampposts, and utility poles. Safety of installation workers. Workers involved in the installation of 5G infrastructure are exposed to potential hazards, such as falls from heights, electrical risks, and accidental exposure to high levels of RF radiation. While protocols exist to mitigate these risks, the sheer volume of work required for 5G deployment could lead to increased safety incidents if not properly managed. Cybersecurity risks. The rise of 5G also brings heightened cybersecurity concerns. Because 5G technology will underpin critical infrastructure, e.g., healthcare, energy, transportation, attacks on these systems could have severe consequences. A breach of sensitive systems could lead to safety risks, particularly in sectors like healthcare, where patient data and life-saving systems are at stake. 5. Regulatory and safety standards. One of the key challenges surrounding 5G deployment is the lack of uniform, evidence-based regulations regarding its safety. Different countries have established varying EMF exposure guidelines and regulations, which may not be sufficient to address the unique risks posed by 5G technologies. Existing guidelines, international standards, the World Health Organization, WHO, and ICNIRP, International Commission on Non-Ionizing Radiation Protection, provide guidelines for safe levels of RF exposure. However, some critics argue that these guidelines were developed based on older technologies and may not fully account for the unique characteristics of 5G radiation, especially millimeter waves. Calls for more research. Given the novel nature of 5G, many health experts advocate for continuous, independent research to monitor and assess the cumulative health impacts of 5G networks. Scientists, regulators, and industry leaders must work together to ensure that 5G deployment is safe and that the health of the global population is protected. 6. Public perception, misinformation, and trust. The rollout of 5G has also been accompanied by misinformation and fear-mongering, which may have significant psychosocial impacts. Conspiracy theories about 5G causing health problems, ranging from cancer to COVID-19, have spread on social media, contributing to public unease. Psychosocial stress. Even in the absence of clear scientific evidence linking 5G to health risks, public anxiety and stress over 5G technology are real concerns. People who believe they are at risk may experience health problems related to stress and anxiety, which can have long-term physical and mental health impacts. Building public trust. Transparent, evidence-based communication is essential for gaining public trust. Governments, healthcare organizations, and telecom companies must provide clear and accurate information about the science of 5G technology, its safety standards, and its potential benefits to mitigate public fear. Subscribe.